All right, welcome everybody. So we will be lecturing today for module 101-1, talking about muscles and bones. All right, and this is an old textbook. We don't use this textbook for this course anymore. You guys can definitely look into it if you want another veterinary assistant textbook. So this is not out of your book directly, but it's really great supplemental information. You'll notice throughout this module and next module, I add in a lot of videos and PowerPoints that are supplemental or ones that I made personally, just so that you guys can get as much information and knowledge as possible. Anatomy and physiology, there is so much going on. And I know that we, being hybrid, kind of cram that into 4 weeks. So we will be covering a lot of material. With this PowerPoint specifically, we're looking at the musculoskeletal system. So this is going to consist of 2 different systems, and they work together to support the body, and they allow for movement of the animal. So we're breaking it down into the skeletal system and the muscular system. Again, that's the musculoskeletal. You can see that those are just combined root words. So the skeletal system, that's going to consist of the bones, joints, cartilage, and also other various connective tissues, where the muscular system is going to be related to all the muscles, as well as other various connective tissues. So we know the skeletal system, that's going to be consisting of bones, joints, tendons, ligaments, and cartilage. So let's break it down and get into our bones. So bones, they are going to form the framework that supports and protects the entire body. A large region for our rib cage that goes across all of those vital organs. So it's to support them, protect them, and aid in body movement. Of course, without those bones and joints working correctly, the animal is not going to be able to fully move and get around. We'll also see the function to form blood cells. Think of the bone marrow and all of the white blood cells and all of that that can be extracted and formed there. And we'll look into how bones are going to be storing and releasing minerals into the body, such as calcium. We also have the joints, and this is going to aid in the movement of the body. So think of shoulder joints, hip joints. That's when we have a long bone with a head that's going to fit into a socket. So we've got a lot of joint movement. We can see bones, joints like that. We can also see like in their knees as well, having that with the kneecap and all of that, as well as the hocks that kind of are like bending backward knees. So we'll look into various different joints on our animals. And then the supporting cartilage. So the cartilage, this is going to protect the ends of the bones where they connect to each other. So think about with the femur, it's going to have a femoral head. So it's going to have that head that's going to lock into the hip joint. But if this was bone on bone, as you can imagine how uncomfortable and how painful that would be, just rubbing in and on each other. So there's a lot of cartilage that's in between, that's protecting around those bones so that they're not just rubbing bone on bone. That's where we see arthritis come in, is when the cartilage has been diminished and then the bones start to become brittle and sharp. Now, bones are one of the hardest tissues in the body, of course, much harder to break than anything else. And we will go over more of dog and cats in this lecture, and we'll get into the different types of bones as well. Now, knowing our combining forms, so what are our root words? Think about osteo, OSC, or OSI. Those are going to be your combining forms that you'll find when referring to the bone, depending on what we're trying to refer to. Now, bones, when they're in their developmental stage, they're going to start as cartilage and more of fibrous membranes. Then as the animal develops and comes into infancy, those fibrous membranes and cartilage will then harden into the bone. So before the patient is even born, this is when all of that developmental, everything's coming together and forming. Now, that formation of the bone coming from the fibrous tissue and cartilage is known as ossification. So again, looking back at that root word, ossification, bones that are forming, becoming that formation process. The periosteum is one of the toughest fibrous tissues that is also going to form the outer covering of bone. And then I'll also touch on the endosteum, and this is another tough fibrous tissue that forms the lining of the medullary cavity. So I'm going to break it down, different types of bones. So a cortical bone, this is the hard, dense, strong bone that forms the outer layer of the bone. Again, so we see a few different types. We have periosteum, endosteum, cortical, and depending on what bone we're talking about will depend on what is that hard layer classified with that. So think of cortical, think of cortex, which means bark or actually shell in Latin. That's how we pull that term. When watching that video, she's talking about all of those Latin terms and how it actually is beneficial to get a Latin dictionary because we pull a lot of these medical terms from Latin. Now, the cortical bone is also known as a compact bone. So when you hear compact bone, think cortical bone. We also have a cancellous bone. And this is lighter. This bone is going to be less strong. And it's going to be found in the ends and in the inner portions of a long bone. So a long bone, think of, let me show you a visual real quick. Think of like the femur or the humerus, tibia, and even radius are part of these long bones. So think of those long bones that are connecting the legs together, front and back. Now we do know that cancellous means lattice work in Latin, and it's also known as like a spongy bone. Again, think of how it's lighter, it's less strong, and it's found at the ends and inner portions. So we're talking about inside, not this hard outside layer. We're more referring to the inside of the bone. Think of the marrow. That's where we're going to find this, where it says spongy bone inside this medullary cavity. And then we also see where the compact bone can be the outside here. Remember, that's the cortex or cortical bone. So compact being the outside, spongy, the callus bone is going to be more of referring to the inside. So there is structure of this bone, and depending on what part we're talking about, will depend on, again, kind of our labeling of the bone as well. So the kind of the heads here, it's going to be epiphysis versus metaphysis, a little bit more inwards from the heads. The diaphysis is the shaft of the bone, and then going right back down to the end notches here. Now, looking at, again, for examples of these long bones, think of the legs, think of the femurs, which are the large bone in the hind end. And then that goes down to into the fibula and, oh, sorry, guys, I'm hitting somebody here. Okay. And then looking at our front legs, we have the humerus, we have tibia, we have the radius. Just looking at all those bones, those long bones, that think of those in the front and in the hind legs. Now, looking at more of these bone word parts. So when we are trying to describe where it is within a bone, looking back at these terms here, think of these all here that I'm talking about, you know, whether I'm talking about the head or the bulbs, the more inner part or the center. Think of how now we're going to look at these word parts and combine these suffix and prefixes in with those root words to find exactly where it is. So epi, that means to be above. Physis means growth. Dia is also referring to between. Peri is referring to surrounding. Is a structure. Endo means to go within or inner, and meta is beyond. All right, moving into cartilage, again, part of our bone family. The cartilage is going to form, it is a form of connective tissue, and it's more elastic than bone, so it does have more give than bone. And when it is healing, it actually does have a faster healing process because it is a little bit softer. So the combining form for cartilage is going to be chondro or chond, depending on, remember, thinking of those additional vowels that sometimes we add in there. Chond would be the term, but we tend to say chondro because it just sounds a lot better, those connecting vowels. Whenever you see the dash O, dash I, dash A, that's a connecting vowel. Some types of cartilage, we have articular cartilage, and this is a type of cartilage that is going to be found covering different joint surfaces of the bone. Think of the meniscus. Guys, what is the meniscus? What's the meniscus? What do you guys think that is? There's a really simple term for it, which is what I said earlier. Where's my little chat bubble? Hello, Zoom. There we go. What's a meniscus? You guys can type it in the chat. What is a meniscus? Think about joints. This is a curved fibrous cartilage found in some joints. Meniscus. Can I get a few more feedback, you guys? Your meniscus is a fancy term for the knee joint. Think of your patella. The meniscus is what wraps around, that's the cartilage that wraps around your patella, which is the kneecap. And animals do have this in their front legs. They will have meniscus, and Yep, with the patella as well. So that is what I'm talking about. The meniscus, this is the cartilage that's surrounding that kneecap. So we find it in some joints. We can also find meniscus back in the hock joints for our patients as well. That's their hind legs. And think about, it's almost like they have reverse knees. So in their front legs, they do have a patella, they do, and you will see the knees inverting just like ours do. But on their hind legs, they have hocks, and they actually invert backwards. So it's a little bit different, but they still have that meniscus tissue. And it's that, again, it's fibrous cartilage that's going to cushion these joints with that excessive movements. So elbow would also be a great answer, knee, elbow. But what I'm specifically looking for is like the patella. So think about how we have those common words, and then we also have more scientific correct words. So try to get into the thinking of using those terminology instead of general terminology, which is what's going to have been a normal for you. Okay, getting into more about our joints. So joints are going to be the connections between the bones, as we were saying before. So think of, how our femur is going to connect into the pelvis, but they connect from the femoral head into that hip socket. So that is going to then be the hip joint. So connections between the two. Now, joints are also known as articulations. And we will talk about how joints articulate. How is it moving? How does that joint articulate? And the combining form that you're going to hear for a joint is arthro. So different from ortho, where we're talking about the bone itself, arthro is specifically looking at our joints. So areas of movement where we're connecting those two joints together, or the two bones together to form the joint. Now, we will classify joints based on their degree of movement. So do we have immovable? Is there some movement, or does it freely move? So we have syntharsosis, which is immovable. This joint is not going to move. It's not going anywhere. Amphiarthrosis, this is going to allow for a light movement. So not very much, but a little bit. Think of like your range of motion, you guys, with your elbow. This is definitely an amphiarthrosis joint because you can move it. It allows for movement, but I can't extend it any further than when it's straight, right? I can't go the other way. I can't bend it that way. I can only bend it in one way. Now, diarthrosis, this is like a freely movable joint. Think of like my shoulder, how I can go in a 360 circle. I can move this wherever I want to. It is very, very freely moving. Now, immovable joints, you can even think of how your the facial bones are going to connect through cartilage and tissue, and there are certain joints that technically are immovable. You're not going to see very many, but think of like facial structures, bones like that. All right, going to talk a little bit about some ligaments. So ligaments are bands of fibrous connective tissue, and they are also going to help connect one bone to another. So you don't just have cartilage, you also have ligaments in conjunction with that to help form and comfort that joint. So the cartilage, it's known to kind of wrap around the bones and protect and have that kind of a cushion in between, versus ligaments, that's what's going to band around these bones and hold them together. So we can't have one without the other. They do have to work in conjunction with each other in order for the joint to be successful and working normal. So ligament, also known as ligamento, is the combining form for ligament. Remember, when we see an O, that's talking about the addition of the vowel, the combining vowel, helping that word just sound a little bit better. That's really the only purpose for it. Our tendons. Tendons as well are going to help connect muscle to bone. So instead of getting away from joints, tendons are what is going to hold that muscle layer to the bone layer. It's not just muscle on bone. We have tendons in between. And they are known to be like bands. You can absolutely do what's called bowing a tendon, which means that it's almost to the point of snapping, but it's actually to the point where it's been so stretched that it bows. So a bow means to have, think of like how a straight line, and then if it were to go to like a half moon, that's a bow. So think of your tendons being that band of fibrous connective tissue, that straight band. And all of a sudden, if it's bowed, it's kind of now off to the side, it's been overstretched. So animals, especially horses, bowing a tendon is really, really common. Now actually snapping a tendon, less common, very, very long recovery process. We see tendons being bowed or stretched like that when the patient is under extreme stress and work conditions. So with horses, this happens a lot with barrel racing horses. Horses that do pole bending, barrel racing, think of rodeo. Those horses are running at high speeds and taking very sharp turns at very high speeds. Rather than race horses, where they're just running very fast in a straight giveaway, these barrel racers, they're having to make tight turns around corners or cut cows, herding cows. And that's where we can see those tendons just completely bowing out, getting overstretched. And it's a really long recovery process. With tendons, when they do bow, we're looking at a 6 month to 1 year recovery or longer. So we really need these tendons. They do a lot for our patients, especially when they are heavy working. But we also have to be careful with them as well, because without that connection from muscle to bone, we cannot have our patients be active, and they're not going to want to be active. It's very painful. Now, the root word for tendon, this is going to be teno or tendo. You can also see tendino, and again, all combining forms for tendon. We can see those combining vowels at the end of all of those, that -o, combining vowel, again, to make it sound nicer. Okay, now looking at the skeleton itself, I'm going to divide it into two different parts. So the axial skeleton, this is going to be what's protecting all of those major organs of the nervous, respiratory, and circulatory system. So guys, what are some organs that are in the nervous system? What organs are in the nervous system?
Your brain.
Brain, absolutely. What else? Nerves, you guys. What tells the body what to do? But where do those nerves run? Think of one structure that bones help protect. Yeah, brain, nerves, spine. Yes, thank you guys. Think of the spinal cord. It's protected by the spinal column. Very good. What about respiratory? What are some organs in the respiratory system?
Lungs.
Absolutely, that's the lungs. How are we breathing? How are we? Yep, absolutely. What's also in the respiratory system? We have our lungs, but what connects our lungs to our mouth so that we can breathe? What is the connection between my lungs and my mouth or my nose? What is this
esophagus?
Sorry, say it again.
The esophagus?
No, the esophagus is what's going to bring my mouth to my stomach, not to my lungs. What am I breathing out of, you guys?
Your nose and your mouth.
Trachea, Yasmin, thank you. Awesome. So it is called the trachea. So guys, we have our esophagus. That's what when you chew your food goes down your throat. It's going down your esophagus to your stomach. When you're breathing out of a completely different airway. Your airway is your trachea. So your trachea is what's going to starts with your nose and your mouth, breathing in and then through your lungs. Wonderful. Now, I also want you guys to think, I know that you guys are in more of a beginner module right now, but I do have a lot of students that are, nearing the end of their program. So think about in surgery, the tubes that we place in the patient's throat so that they can breathe is an endotracheal tube. It goes into the trachea, that is their airway. Now, what about circulatory system? What would be some organs in the circulatory system? Circulatory. What circulates around the body? What keeps us living? What is circulating constantly?
Heart.
Yeah. Heart, our red blood cells, white blood cells. I see veins, arteries would also go into the circulatory system. So our heart, we know that's going to help pump it around our body. It's going to flow through arteries, veins, keep everything going. Yes, absolutely. Good job, you guys. Perfect. Wonderful. So when we're talking about that axial skeleton, again, we're talking about the skeleton that's going to, in the aorta, that's one of the biggest valves that comes out of the top of the heart. So again, the axial skeleton is going to protect these major organs. So think about it, you guys. What bone is protecting the brain?
The skull?
The skull, absolutely. What about the spinal cord? What protects the spinal cord?
Our backs? I mean, our rib cage? No.
Spine.
Did someone say spine?
Yes.
Wonderful. So it is the spine. Your spine is going to be wrapped with your, yep, perfect. Sorry, I'm reading wonderful, with the spinal cord. Good job, you guys. Just looking at your chat. Now, when we're talking about the respiratory and circulatory system, what about some bones that are helping protect that? What is protecting that thoracic region? Yeah, the ribs. What is the combining bone that holds the ribs together? The ribs aren't just free floating, you guys. They combine together. There is a bone right in the middle.
The diaphragm?
Sternum. Good job, you guys. That is the sternum. That is what's going to connect the ribs together. So if we have to do a thoracic procedure, we usually have to break the sternum to then crack the rib cage open. So it does have a bone that's connecting all of those ribs together. Wonderful. Yeah, good job. So again, all of these bones, they're working together to protect these vital organs. Reasonably so. If we lose one of these organs, whether it's nervous, respiratory, or circulatory, we are in trouble. We cannot function and maintain and be alive without these three major organ systems working. So think about how the axial skeleton, it's going to be like the framework of the body. Got another student coming in here. Okay. Alrighty. Now, the second part of the skeletal system I wanted to talk about is the appendicular skeleton. And this is going to consist of all of the extremities. So think of like the shoulder, the pelvis, the pelvic girdle. So appen, that means to add or to hang. So think of how limbs, they kind of like hang. They do hang off of our shoulders, they hang off of our hips. So any of those extremities. So this is going to consist of bones that are in the front and the hind limbs for our patients. And they are really similar to us, you guys. Our bones that are in our arms, same bones that you're going to find in your patients, with that being your humerus, your ulna, your radius, your hind legs, or our legs. That's going to be your femur, your tibia, your fibula. And then of course, all of the phalanges and the carpal or metacarpal and carpus bones. A little bit different with our pets. They do have more metacarpal and as well as carpus bones than we do, depending on the patients. And they do have those dew claws. So a little different, but very similar. Now, coming back to that the axial skeleton, I want to take a look here at the cranium. So the cranium, this is the portion of the skull that encloses the brain. So the skull that you guys are looking at right here, what skull are you guys looking at? What animal does this belong to? What do you think? What does this look like?
It's like a horse.
Horse.
Yeah, this is a horse skull. Yep. So you guys can see the teeth are way further back in their jaw. They're known as grazers. So cows are the same way. They do have incisors. They're really just like bite, itch, nibble at things. But really, they're actually grinding their back teeth in order to chew their food. So can kind of tell right off the bat, just by even looking at their dentition, what breed of an animal this is. So looking at the skull, our combining form for the skull is going to be cranial. And the skull is also going to have air and fluid filled spaces called the sinuses. So you can see sinuses, it's going to be in the nasal cavity. You can see that there. Now, if you do decide to kind of like expand your knowledge, go to tech school, you're going to learn about the different fossas and all of the other different kind of air or fluid filled spaces in the cranium, but I'm not going to get that much into detail with this. Now we're going to put this together. This is more of a full horse skeleton. So from the cranium going down the different vertebrae. Now with that axial skeleton, again, we were talking about the vertebra because it's going to be protecting the spinal cord. So we have that going all the way from the head down the body and even through the tail if the patient has a tail. So it's comprised of individual bones called vertebra. So each one of these bones is considered a vertebra, but together they are vertebrae. So vertebra, singular, vertebrae is plural. So we have starting off is cervical vertebrae. That's the neck and up to the head. So connecting the cranium down to the shoulder is cervical vertebra. You will see that the first two vertebrae are labeled. So we have like the atlas and the axis, that's C1 and C2. They actually do have names for all of these down the cervical, thoracic, lumbar, sacral, coccygeal vertebra, but I'm just don't need to get into that much depth for this specifically. But just know that they do have individual names. We do label them so that we can tell exactly where the problem is, especially if there is spinal compression or there was a spinal injury. So we have cervical, that's going to come into thoracic. So we know thoracic, that's talking about the chest region. Lumbar, that's going to be kind of their back, connecting from after their rib cage to then to their pelvis. So we got our lumbar. Sacral is actually going to be kind of that end little part here from the tip of that pelvis, kind of all the way starting of the tail, but sacral can also be combined into coccygeal, which is then the length and the rest of that tail. Now, this is just kind of going over again what I was saying, that we do divide these into 5 different sections, cervical being the neck, thoracic being the chest, lumbar, we know that's the lower back, sacral is more of the hips, and coccygeal is the tail. Now, when we're looking at the vertebra itself, it's going to be divided into different parts, having like the body, the vertebral body that's down here. So the spinious process, this is the spine. So when you feel along the back of your patient, this is the bumps that you're feeling. You're feeling the spinious process. So these will actually stack on top of each other. Remember, they are the vertebra as singular, but vertebrae together. And as they move through the body, you can see they're a little bit larger. When we're talking about cervical, they get a little bit smaller. The spinious process does get larger and taller, and then it can get shorter again. So depending on where it is in the body, even if I just have one singular vertebrae, I should be able to tell where it came from just by looking at the shape of the vertebra. So again, we have like the body, the arch, which is this top little area here, the lamina. We have the vertebral foramen, and foramens also mean to have a gap or a hole. So fossa, foramen, those are all different terms for just having blank space or space filled with air or fluid. And then different processes. So your transverse, your articular, and your spinaceous process, again, those are all going to be different depending on what section of the vertebrae you're in. All right, breaking it down, more of this axial skeleton parts. We have the ribs, the rib cage. We know that we have our ribs that then combine with the sternum. So this being the sternum here that's holding all of the ribs together. At the very bottom of the sternum, we have the xiphoid cartilage or the xiphoid process. Know that for ribs, the combining form is going to be costo. So ribs, sternum, those all working in conjunction together. So they come off of the thoracic vertebrae, the ribs do, and then they form again together by the sternum. And we do count the ribs. Most animals have 13 to 14 ribs, kind of depending on just the type of animal, the breed, and we will label it as such. All right, now we're going to change gears and we're going to look at the appendicular skeleton. And actually, before we do that, we're going to take a little break because we're almost about an hour in. So instead of hopping right into this for a slide or two and breaking, we'll just break right now. So let me stop my share here real quick. All right, so we're going to just pick up right where we left off, which was talking about the appendicular skeleton. So we just finished up talking about the axial skeleton, which we know that is going to be protecting all of those vital organs. So now the appendicular skeleton, this is talking about the limbs, looking at the front limbs, the hind limbs in particular. So I'm going to go through a few slides showing you, this is a skeleton on a canine, also known as our dogs. So looking at our canine here, we have building up here from the scapula, that's going to be their shoulder, you guys, and there's subscapular spine. That's that that shoulder groove that you can feel when you're feeling along the scapula or the shoulder blade of your patient. Coming down into the humerus, that's the large bone here that's connecting from the scapula down that front portion of the leg. It's the large bone there. We then have two smaller bones that are going to have that joint connected from the humerus. So we have the radius, the ulna, then coming down to the carpus or the carpal bones. Then there is also the metacarpus and then the phalanges, those are the toes. Now with livestock, and I'm going to show you guys a picture here in this next slide, they don't have metacarpal bones per se. We call their metacarpal bones, these bones down here before we get into the sesamoid and the phalanges, that is the cannon bone. So it's very different with livestock. Really plain and simple with our dogs and cats. When we get into livestock, talking about horses, cows, llamas, alpacas, goats, sheep, swine, we're looking at a little bit different because they don't have phalanges, they have hooves. So, and their bones are a little bit different as well. So with horses, it's just a little bit further moved up. So again, still have our scapula, got our humerus here. We have radius, ulna is much tinier in horses. Carpal bones for the horses is right at their knee joint. Then we get down into the metacarpal bones, which is also known as the cannon bone, this long bone here. It goes into the proximal sesamoid and then the distal sesamoid. This is also known as the cannon. So we have the cannon, the coffin bone, which is actually going to go more into the hoof, and then the navicular bone as well. So a little bit different with our naming. And we also go from like P1 to P3. So P1, that's going to be proximal 1. So that's the long pastern bone in livestock. Pastern bone is going to be directly after or considered to be the proximal sesamoid. The P2, this is the short pastern bone that we see in livestock, so directly after that. or also known as the middle phalanx. Then P3 is that coffin bone. So I was talking about the cannon bone. The coffin bone is right down that actually goes directly in through the middle of the hoof. Now, in small animals, we could be referring to this as like their claw or their nails. In horses or in livestock, we're looking at the hoof. Now, the coffin bone is actually the bone that sits right in the middle of the hoof. So that's what is going to be helping the articulations, the movements of those joints. And that also comes into play when we're talking about especially livestock, when we have a fracture or a broken bone. This is when a condition called laminitis can occur. So with our horses, a big reason that we cannot just repair their limbs and, you know, place screws and joints and all of that is because they are at risk for laminitis. Now, before I just go and tell you guys what laminitis is, does anybody here know about horses or know what laminitis is? Have you ever heard of it? Anybody heard of laminitis? No, no problem. So laminitis is a condition that happens when there's too much weight put on 3 limbs instead of 4. So if the horse has a broken leg, they can't just not put weight on that leg and stand on all other 3 legs. What'll happen, because they have such body mass, they are massive animals, you guys. When we're putting all of that weight into 3 legs instead of 4, the coffin bone will actually start to push through and down, and it'll actually push out of the hoof. This is a fatal condition. It's really, really sad. And that is a big reason why when a horse breaks its leg, it's kind of a death sentence. Because even during recovery, we can put them in harnesses, we can try as best we can. Laminitis seems to always occur. And once laminitis starts, we can't stop it. So this bone sits right in the hoof. And when there's too much pressure on it, it starts to push through until it completely pushes through the hoof. So it's really traumatic. It's really awful. Again, that's why you'll see if a horse breaks its leg, or even livestock, you know, with our cows, it absolutely is, it's a death sentence. It's really hard to recover. I don't know. I know that I don't have very many horse people here, but if you guys thought back to Barbaro, he's a huge racehorse name, and he raced back in the early 2000s, and he shattered his ankle in one of the big races that he was in. And you guys, this was a big money racehorse. He was a stallion, so could make a lot of money with breeding and having babies. So they dumped, like, I want to say $3 million into this horse. They put him through 9 different surgical procedures. And in the end, he still got laminitis. So even with all that money, that's not even a factor. The research just isn't there. So sorry to go into a little tangent, but it is really important. And it's just also another fact about these animals and something that you can share with other people. That's a big reason why. And it just has to do with the different bone structures and how that's set up with the bones and the hooves. No, they do not. So there is not enough research out there for prosthetic limbs for horses or larger livestock. And again, that's because even when we put them in a fake limb or sling, things like that, it still is off-putting that pressure. And laminitis can also start because of stress. So unfortunately, we're just not there yet. And even with the clients, you know, people that have the insurance and can pay all the money, we're just not there yet. I'm hoping within the next 20 years, that'll be something that is medically advanced enough for us to actually say that horse has a better prognosis of surviving. But right now, there is no prosthetic limbs or anything like that for our livestock. Now for dogs, cats, no problem. They can go without their limbs, no problem. We can see the tripods, those 3-leggeds, and they do just fine. But when we're dealing with these larger animals, you know, horses are 2,000 pounds, you guys. So taking one limb away from them, that's a lot of stress to put on the others. So again, just different anatomy, and there's reasons for that. I know the tripods are so cute. I love it when they're actually dipods and they just have the front legs and then they have a little wagon in the back. It's so cute. I love it. They're like the happiest go lucky, wonderful pets. So hopefully one day we'll get to that point with the horses too. I really hope. All right, now getting into looking at our kitty cats. So again, a little bit different looking from our, especially from our horses, but even our dogs. It's more of just the length of these bones vary. So going back to the, oh, where we go. So the dogs, looking just at the angles and the lengths here of their humerus, and also relating to the radius ulna, looking at the femur. So look at just how different the angles and the structures are of those bones. They are the same bones. We have the scapula connecting to the humerus, radius and ulna, femur that's coming up here from the pelvis, fibula, tibia. So again, same bones. They also do have carpal bones, metacarpal and phalanges, and metatarsal, tarsal bones and phalanges. So it's the same as dogs, but wow, the angles and the shapes do look a lot different. So thankfully with our small animals, it's pretty straight across the board, but this is why, especially for your projects, you guys, I was stressing on looking at both dogs and cats, because you can see, even though their bones, they have the same bones, look at how different they are. And same with that, think about how differently placed the organs might be too. Look at the curvature of their spine. Look at the length of their cervical from their thoracic to their lumbar versus dogs, very different. Now, when specifically looking at the pelvic bones, this is the pelvis, you guys. So we have just different parts here. The ilium, that's going to be the longer part that's stretching up, kind of those hip bones that you can actually feel. The pubis, that's kind of this combining part here between the two. We have pelvic symphysis, which is the line that's going down in between kind of the center of the pelvis, the ischium, and the acetabulum. So the acetabulum that you see here, that groove inside, that is the bony part of the socket joint. So where the hips are going to come in, all of that cartilage is going to be surrounding tendons are going to hold them in. So, but that is the acetabulum. Oh, awesome. Wonderful. Okay, now getting out of talking about bones, I am now going to switch gears and we're going to look at the muscular system. Again, remember musculoskeletal, so we can't have our skeletal system without our muscles that are holding everything together. So the muscles, these are organs that contract to produce movement. And they're responsible for the following. So ambulation, so talking about, flexion and extension from those joints. They can help control organs and tissues. Think of contraction of muscles for a lot of our organs will have. The pumping of blood around our body, think of that circulatory system. Our heart is a huge muscle, and generation of heat for this patient. So if they have very low muscle mass, think of our elderly patients, especially like old kitty cats, kind of get a little bit more frail. They aren't going to have a lot of muscle, which means they are at risk for hypothermia. They cannot generate as much as their own heat and keep warm like animals that have more substantial muscle. But again, we're going to see that kind of phase out as they get older anyways. You can't do a whole lot with muscle loss with age, besides just trying to support them. Now, when we're looking at our muscles, they're made up of long, slender cells that we call muscle fibers. And we also have different groups of muscle fibers in fibrous sheath. So myo is going to be a combining form for the muscle. We also use the words fibro or fibroso for combining forms for when we're talking specifically about fibrous tissue. Taking a look here at some of the different muscle tissue. So we're looking at this fiber here, kind of looks like a strand, and they're all of these striations. Those are those cross stripes that you're seeing going down those muscle fibers. So these are considered to be striations or striated skeletal muscle fibers. And we can also see this is what it looks like under the microscope. Getting into some more, we have cardiac muscle fibers and smooth muscle fibers. So cardiac, think of those cardiac muscles, the heart, the circulatory system, all of that that's combining. So we do see the striations across these muscle fibers, and they do have a centrally located nucleus. And we can see the nucleus, that's that dark purple that's uptaking all of the color. And again, just those different and a lot darker in color with those striations. Same with looking at the skeletal muscles, the striations are a lot darker. Now, when we don't see any striations on the muscle, when we're looking at like smooth muscle, this is non-striated, look at how different that looks under the scope. It's way less pungent in color. Now we can still observe the nucleus, that's that dark purple uptake on the stain there, but it's definitely not as pronounced as looking at our other cardiac or skeletal muscles. Now, looking at some other structures that are associated with our muscles, we have our fascia, and the fascia is it's kind of like a sheet of fibrous connective tissue, and it covers, supports, and separates muscles. So if you ever get to go into a necropsy lab or continue your education, whether that's getting your technician's degree or going on to doctorates, you are going to be able to do a lot of necropsy lab. Now, necropsy is just the term for an autopsy on an animal. So we don't say autopsy, that's a human term. We say necropsy, that's for an animal. So we're looking at a deceased animal for research purposes. And it's really weird fascia. It's like it almost kind of looked like a light cotton in between the dermal layer and the muscle layer. So it's in between the two. And it does cover, it supports. And then it also, you can feel the fascia goes along each individual muscle. So it's not like all the muscles are just slammed together. The fascia actually does really help clearly identify and separate those muscles. So it's really interesting. Again, if you ever get to help perform a necropsy, you'll get to really see this in person and how it does separate those muscles. And we have fascia all over. That's every living mammal is going to have that fascia from that dermal to those muscle layers. Now, the combining forms that we use for fascia, that's fascio or fasciae. And again, think of how we have the fasciae or fascio. Those are those combining vowels. Again, can be O, can be I, can be A. I also want to talk about tendons. Now, as much as tendons are a part of that skeletal system, they're also, of course, associated with our muscles, because we know that tendons is what going to connect the muscle to the bone. So we will see them in both different systems or to other structures like organs and whatnot throughout the body. And they are considered to be fibrous connective tissues. Those combining forms we see for the tendon, again, are going to be tendo, tendino, and teno, seeing those connecting vowels there. And thinking about tendons that connects muscle to other structures is like the linea alba. And now the linea alba, that's a fibrous band of connective tissue on the ventral abdominal wall. And it's the median attachment of the abdominal muscles. So guys, where is ventral? What is ventral? I see some people pointing. Yeah. So ventral, we know, you guys, that is on the belly, the abdomen of our patient. Yes. So when we're looking at this linea alba, this is what's going to connect all of those muscles together in the abdomen. Yeah, the belly. Exactly. And without these tendons, this wouldn't be possible. It wouldn't hold all of those muscles together where we need them to be. So it's the median attachment. Now, median, you guys, median is just also meaning like medial, which means to go towards the midline of the body. So think towards the center, the median, the middle. We also have the aponeurosis, and this is a fibrous sheet that gives an attachment to muscle fibers. It serves as a means of origin and insertion for different types of flat muscles. And remember, those flat muscles, they're similar to smooth muscles, not having those striations throughout. And it's similar to how those tendons give those attachments between muscle fibers. And aponeuro is going to be that combining form for aponeurosis. Getting into some more muscle terms, that's kind of what we're going to end out the lecture with. The next few slides, I'm going to talk about how we name muscles and different terms that we use. So I strongly recommend downloading this PowerPoint and using it for homework or your assignments in the future. We're going to keep on talking about these terminology and root words, all of that, in continuing in 101-2. So different muscle terms, kinesio and kinesis means movement. So kinesiology, that's the study of movement. Actually, my partner graduated as a kinesiology major. And kinesiology being the study of movement, that's a lot of people that go into like chiropractic, physical therapy, occupational therapy, sports therapy, sports medicine. So thinking of all of those movements, that is kinesis or kinesthetic. Now we can see some combining words here like anti meaning against or agon being a struggle. So for example, antagonistic muscles will work against or opposite from other muscles. And think of like extension versus flexion when you're moving your arms or your limbs, different muscles that work against each other for different types of movement. Now another of these root words that we're going to be looking at. So syn, that means to be together. Erg is also to work. So think of synergist. This is an example. Synergist muscles work with other muscles to produce movement. So they're all working together to get that portion of the body to move. And they're all going in the same direction. They're all moving together. Now, looking at some muscle movement terms, you guys don't really need to know exactly what all of these are and what they mean, but good to know these terms moving forward. So we have like abductor versus adductor, and a lot of this has to do with like the flexion of a joint and the extension. It also means about like the way that they're rotating around or the way that they're not rotating, whether it's upwards, downwards. Again, don't stress, you guys. You don't really need to know these at the moment. I do believe that when you're doing your definitions, they might come up in some of your definitions, but these are just some examples of muscle movements. So going that abductor, we have adductor, flexors, extensors. You guys hear me talking about that a lot. Levator or depressors, rotators or supinators. So thinking about like rotating or opposite, rotating out. And then pronators muscles, those are muscles that rotate. Think of palmar and plantar surface downwards. So guys, what is palmar? Where's the palmar region on our patient? Yep, palmar, awesome. So we know that that's going to be those front paws, that back surface. So that's going to help rotate the surface down. So think about like when the patients are running and moving. So it doesn't just also, you know, it goes up, supinator moving up, but also pronation moving down. So these are all just those directional terms there. And then muscle location terms, talking about like pectoral, we know that that is, think of pecs. So the thoracic type of a region, epaxial, intercostal muscles, like in between the ribs, epaxial, talking about like down the spinal or even in the hind end, and infraspinatus as well. Yeah, guys, and I can definitely, after we're done with lecture, I can show you guys exactly where to find this, just so that you guys are sure on where to get this, where to get the PowerPoint from. And know that the PowerPoint that I have downloaded has a few more slides on it. They're like test slides. So I'm not going to go over them because that's for you guys to use for studying. So it's a little bit lengthier because it has kind of some study guide slides that are on there. Different muscle fiber directional terms. We have like the rectus, we have oblique muscles, transverse or sphincter. And again, that has to do with what the muscle fiber is going to be doing. The muscle division terms, we have like biceps, triceps, quadriceps. So talking about where those divide, and those are all pectoral muscles. Different size terms, minimus, maximus, major, minor, latissimus, longissimus. So for example, they do have a muscle called the latissimus dorsi. It's a long muscle that goes down the leg. So when you guys, if you do decide to continue on and go into tech school or go for a doctorate, know that this is when you're going to be diving into all of these muscle size and all these terms that I'm talking about in extreme detail. For being a vet assistant, you really just need to know general anatomy and knowing where these structures are, but it is important to see these names and have some type of an understanding, but you don't have to know exactly what it means. You'll learn that in a more advanced anatomy course. Some more shapes. We have like the deltoid, the quadratus, the rhomboideus. And that's going to be it. Like I said, on the other PowerPoint that I have downloaded, there is a lot of other test slides, examples that are on there. So I'm just going to get out of this PowerPoint and let me get to, actually, I'm going to stop my share here for a second. I just want to pull up my webpage that has your course so that I can show you guys where to find the PowerPoint. Oh, and also guys, while I have you all here, I want to make sure if everybody can please go on to LMS and make sure that you are also now registered in 101-2. So everybody, we're in 101-1 right now. And yesterday I put all of my students into the second half of the module. So you guys can start looking into what your second half is going to look like, because that's going to start next Tuesday. So if you don't see that module, I really need you to message me, let me know so that I can add you. So just double check, make sure that you see not only your 101-1, but you should be seeing your 101-2. Okay, so going into your 101-1, I'm going to click into here. We are on week 2 right now. So you're going to scroll down to the lecture tab. Anything that's blue is hyperlinked. So you can click right into here. We just did the musculoskeletal anatomy PowerPoint. When you click on it, it's going to download it for you onto your computer. From there, you can click into the download. It's going to open it for you. And then you can save it, like save as, and then you can save it onto your, make sure that you switch it from downloads to desktop or wherever you want it to be. And then you can save it on your computer. So that'll be there for you guys. On Monday, we are going to hop into this veterinary anatomy head to toe. It's a shorter presentation. So because I didn't get to it last week because Mrs. Reincom wanted to cover it this week for her students, we're going to be doing chapter 3 and as well as the head to toe PowerPoint for next Monday. Now, both of them, they're like 20 slides long. They're really short PowerPoints, so it shouldn't be any lengthier than what our regular sessions already are. But just be aware of that I'm not forgetting about that chapter 3. We're just going to move it to Monday instead. All right. So that'll be then that'll be the end for the musculoskeletal system for today.